Assalamu alaikum. Welcome to another episode brought to you by AccidentalMuslims.com, sharing my story and my journey on healing myself through my depression. Today we're at the practices of Doctor Jeetesh Ranchod. He's my personal and my family GP. So today we're going to have a bit of a chat with Dr. Ranchod. So follow me.
My name is Jeetesh Ranchod and I'm a GP. I've been practicing for more than 20 years, and I've also a homeopath which I've been practicing for the last 10 to 12 years. And my general practice has shifted from being a purely Western medicine based practice to incorporating more homeopathic approaches to treating conditions. Yeah, so I think when we talk about depression, one tries to look at what the social context may have been, where the person's become depressed. But that would be more in approaching the management. But I think if you're looking at the person coming to the doctor, and what's going to lead him to come to the doctor. And as you've mentioned, there is a stigma to people being called depressed or being on medication that they have to take for long periods of time for treatment of depression. It is considered an illness, so one shouldn't label it in a negative way. But people often do not recognize that they are suffering with it. And there can be just occasional outbursts in the house where, if we were to look at one member of the family who's always angry. And as much as one would say that he has an attitude, anger may just be a form of someone being depressed, and that's the only way that they can try to show that there's something not quite right with them. So symptom-wise, it can manifest in unusual ways. I think the more usual ways, one is familiar with loss of appetite, or just sleeping the whole day away, not interested in doing pleasurable things. And we have certain criteria that we look at to label or diagnose depression. But it may not be that simple, Occasionally, even things like substance abuse could suggest that there's an element of depression with the patient. So I think when one has seen a change in the behavior of a family member, or if within the person himself is noticing that he is not really acting to his potential or achieving to his potential, or he finds certain other changes within him, is to perhaps approach the GP, to say, I'm noticing things, is it possible that I'm depressed? Or the GP generally doesn't jump onto that diagnosis immediately, and we may look for any other pathology. If he's complaining about being tiredness, he or she, they could be anemic, So there may be a physical and medical cause for their symptoms. But at times, if that has been ruled out, then one needs to entertain that possibility that there is a mental cause for it, an emotional cause for the behavior. And then one needs to pursue that, and talk about it. We do see occasionally quite a variety of presentations of depression. Sometimes chronic pain could also be a sign of depression. Chronic headaches, for example. So, as I said, it's not something we want to jump onto immediately.
Homeopathy.
Right.
And I think it's a unique and interesting way Firstly, what really encouraged me to bring my family here was the fact that it's natural.
Sure, sure. Yeah, so homeopathic medicine is a bit different from the normal Western medicine, and the approach when we say holistic is that where we look at the person in a much more complete way than Western medicine would. Whereas with Western medicine we are more symptom based and trying to relieve symptoms. When we say holistic with homeopathy, the patient's appearance is also taken into consideration. So if it's an obese patient, is it a thin patient? Is it a very hairy patient? And these kind of minor factors are taken into consideration when prescribing the appropriate homeopathic remedy. So in order to do that, one needs to know much more about the patient because we rely on that information. So a patient may say, well, you know, I'm having difficulty sleeping and my mood is very down and I don't enjoy eating. And
I don't enjoy sex.
You don't enjoy sex. So one may imply that this is this sounds like depression. So homeopathically we don't have antidepressant medication. So what happens is we may make this diagnosis of depression, but it's who is this person? What is his emotional makeup? What is his physical makeup? The homeopathic remedy is directed and say for example this is a very thirsty person and it's a very thin person and it may be a very sort of type A personality where he is very restless and constantly driving himself, very ambitious. So all of those factors are taken into consideration, and a homeopathic remedy that's been used in those sort of circumstances is then given to the patient. So in other words, we are trying to rebalance. So we may have a type A very successful businessman that has had burnout, you know. So it's very easy to prescribe an antidepressant to lift the person up. But the fact that he is a very successful businessman, that aspect is also taken into consideration in prescribing the homeopathic medicine. So that's what we mean by holistic. So for example, there may be a student who's studying and is feeling the pressure of having to pass his exams because he's on a bursary and he won't be able to continue the payment unless he's successful. That pressure can also cause burnout, and that is a different scenario. So, you know, one doesn't want to just go antidepressant there again. Here we have a student who needs to perform well and therefore is depressed. So that whole scenario is taken into consideration, and then a homeopathic remedy is prescribed for that situation specifically. And therefore the homeopathic remedies can be very effective if chosen correctly and in trying to rebalance the person.
Excellent.
I think we will find in many households there may be that one child or parent that the rest of the family thinks is not really performing or acting in quite a normal way, and one always tries to work around the person, you know, or label the person as, he's always an angry person, or, you know, he always just lays around, or he's like that. And one needs to perhaps just take a step back.
And then we start accommodating.
And then we start accommodating. We accommodating, and we change our whole lifestyles to exactly. And it's good to just sort of take a step back and say, but you know, maybe there's a depression here, or maybe there's a anxiety disorder, and this is why he's doing this, you know. And there may be some background family issues, maybe divorce, maybe loss, grieving, things like that. So I would encourage people to, try and inquire a bit more, try and read up about it, and make that step to try and make that family a bit more whole again, you know.
I mean, it's really been enlightening, and I'm sure for many seeing this video, they will feel, I'm almost positive, equally as enlightened as I was the first time I met you. And thank you very much for your service to the community.
You're welcome. It's a pleasure.